Okay, this video is psychiatry a joke? This is part 3, and part 3 will feature Thomas Szasz. Thomas Szasz MD is a physician, he is a psychiatrist, and he wrote a very famous book in the 1960s called The Myth of Medical Illness. And he was really a brave guy to sort of take on conventional psychiatry. And man, is he smart. This guy's brilliant. I read that book and a couple of his other books. I think The Myth of Psychotherapy also was by him. He does have some YouTube videos. So anyways, here's a quote from him. Labeling a child as mentally ill is stigmatization, not diagnosis. Giving a child a psychiatric drug is poisoning, not treatment. So yeah, I like that. He's protective of children. I can tell you, the Ivy League and these other famous universities, what they have done is just awful. It's beyond wrong. It's evil. So these evil big-name university psychiatrists, they get money from the drug companies to try to prescribe more drugs as much as possible. That's why I had that recent video that was Psychiatry a Joke Part 1, showing that the DSM itself is kind of a joke. A couple psychiatrists, many of them affiliated with Big Pharma, just wrote out diagnoses so they could sell more drugs. And these drugs, they have very poor prognosis long-term for these children. They often become chronic psych patients taking more and more pills. The first one induces a side effect, a pill for that side effect, and whatnot. Okay, so that is a good point. They're not honorable people. They're not doing anything good, and you need to realize that. You know, the myth of physician infallibility is long over. Okay. Okay, so here is the title of his book, The Myth of Mental Illness. You can also get that on audio CD, so you can listen to it in your car. It's very good, very entertaining. Here's another good quote by Thomas Szasz. Clear thinking requires courage rather than intelligence. And that's very true. Most doctors, they are hard workers, they're conscientious, but they're also very conformist. In order to get through pre-med and med school and residency, you have to basically shut up and do tons and tons and tons of work, no matter how stupid it is. And it's very hierarchical. You know, you don't get reward points for questioning conventional standards of care or your senior resident or your senior attending. You get rewarded for shutting your mouth and getting your work done so everybody can go home. Okay, and making money for wherever you work, your clinic, your hospital, whatever. So the patients, as bizarre as it sounds, patients, the way the healthcare system is designed, it doesn't keep track of whether or not patients get better in general. And they're kind of considered as irrelevant. As long as you provide the standard of care, whatever happens to the patient doesn't matter. It's seldom talked about or followed or anything. But to the patient, that's what matters. Do they get better or not? Okay, so we're going to continue with a little more Thomas Szasz here. He lived from 1920 to 2012. And he does exaggerate a bit, but man, is he smart and clever and interesting and often funny. So here's what he has to say about mental hospitals. Mental hospitals are cemeteries for the living dead. The dormitory beds are the grave sites. The psychiatric diagnosis, you know, on a piece of paper over the side of the bed is the gravestone. Psychiatrists are the grave diggers, and the patients are the corpses. He also talks a lot about how patients are stigmatized by being labeled with these insulting diagnostic terms. So here he goes. If you want to exclude people from the social order, you must justify this to others. So you invent a justificatory rhetoric. And that's really what nasty psychiatric words are all about. They are justificatory rhetoric legitimizing the removal of people from society. It's like labeling a package garbage. Being considered or labeled mentally disordered, abnormal, crazy, mad, psychotic, sick, it matters not what variant is used, is the most profoundly discrediting classification that can be imposed on a person today. Mental illness casts the patient out of our social order just as surely as heresy casts the witch out of medieval society. That indeed is the very purpose of the stigma terms. Yeah, put a label on them and you can justify selling them a toxic drug that causes a chemical lobotomy. And when I think about this, I mean, that's also how arguments are often won. If a person is smart, you're not going to beat them on logic and reasoning quite often, so you just label them with a psych disorder. My wife, you know, she couldn't win an argument with me, so she would just call me, you're autistic, you're so effing autistic, you're so obsessive compulsive. And, unfortunately in a family, that's usually an effective way to win an argument, even though I would not agree with it. Okay, Thomas Schaus continues. In the animal kingdom, the rule is to eat or be eaten. In the human kingdom, it is to define or be defined. He who defines dominates. That's also true. A relatively small group of individuals, if they're able to control the terms of the debate, the terms of how a situation is defined, that gives them a giant advantage, even if it's a very unfair one. And that is a common thing in modern society. Thomas Schaus continues, the scapegoat is necessary as a symbol of evil, which is convenient to cast out of the social order, and which through its very being confirms the remaining members of the community as good. Oh yeah, that's a typical thing too. And this can be used by psychiatry, and this is also, of course, used in society to try to blame all one's problems on some other group, some other ethnic group or gender, and then use that as an excuse to do all kinds of bad things. Okay, but we're not going to talk about that today. Thomas Schaus, now we're going to talk, there's something called an escalated metaphor. You can have a metaphor, and just like a singer takes a note higher and higher, or a musician, like Mozart would do with his Serenade of the Winds, beautiful song from the movie Amadeus. You can escalate a metaphor. And so here's an example of Thomas Schaus escalating a metaphor. Psychotherapy is the medicalization of human social problems, 100%. Psychoanalysis is medicalization squared. And psychiatry is medicalization cubed. That's very clever. Okay, and yeah, the terms used in psychoanalysis are so insulting, and it's so degrading. Degrade, denounce your parents. Okay, what an evil bunch of crap that was. Okay, and psychiatry is evil. It's perhaps the worst field in all of medicine. These drugs routinely cause the equivalent of a gradual, progressively worsening chemical lobotomy. The more you study them, the more shocked you will be at how bad they are. Okay, Thomas Schaus continues. The less a person knows about the workings of social institutions in a society, the more he must trust those who wield power in those institutions. And the more he trusts those who wield such power, the more vulnerable he becomes to himself becoming their victim. And that's part of what I'm doing. I'm trying to, teach the persons who watch these videos about how the healthcare system works, so you can protect yourself. Okay, because it's very dangerous. Theoretically, the most common cause of disease is coronary artery disease. Second most common, theoretically, is cancer. Okay, but it's really not necessarily that symptom. And then the next thing, officially, so to speak, will be side effect of drugs, even when they're properly prescribed. And then the next thing will be like dementia. However, I would say that dementia is probably more important than is realized, because lots of people, they're walking around and they're able to talk a little bit, but they no longer can do anything that they used to do. So what I'm saying is lots of people are demented, and that doesn't often get on their death certificates, and they'll get listed as dying for some other reason. What I'm trying to say is a lot more people are demented than is recognized. It's super common. Like I said, my internal medicine friends, some of them tell me that every single one of their patients over 60 is cognitively impaired, cognitively slow. And in my experience, that is very often the case. They're just sad, pathetic people who have zero hope of ever getting better. Okay, Thomas Schaus continues. The fundamental conflicts in life are not between competing ideas, one of which is true and the other is false, but rather between those who hold power and use it to oppress others, and those who are oppressed by power and seek to free themselves of it. Okay, and that reminds me very much of Aristotle's concept of debate. Aristotle had talked about how a debate between men of Athens should be a question of whose logic is superior, whose arguments are better. But then I forget the other author's name who said that's not how arguments are decided in small social groups and families and stuff. It's usually whoever can create a more emotional story to support their point of view rather than a better logical story. And unfortunately, that's how a lot of policies are decided in society. And whoever can shape the debate and create the emotion on their side, come up with the best slogan and have the most ability to enforce it, will get their way, even if what they're doing is totally wrong and evil. Okay? And it takes close thinking a lot of times to understand these sorts of things, the nuance of them, what they really mean. A good example is one, I'll give a quote here by Ayn Rand. she talked about how John Stuart Mill's, idea of utilitarianism was really evil, that, the greatest good for the greatest number. That sounds nice on first glance, but basically what that means is if there's 10 people in a group and 9 out of the 10 say they want cannibalism to eat the 10th person, that would meet the criteria of John Stuart Mill's utilitarianism. So Ayn Rand would then counter that by saying the smallest minority is the individual, and you're not going to have a good society unless you respect individual rights. And I would echo that with, you're not going to have a good society until you have Christian ethics, with the idea that man is created in the image of God, therefore partly divine, as well as certainly part beast, but being part divine, entitled to natural rights, to life, liberty, the pursuit of happiness, as the Declaration had said, as well as property rights, privacy, free speech, and all those things. Okay? And if you don't have it, you're kind of screwed. And I've said it before, I'll say it again because it's true. If you don't bring Christian ethics back to healthcare, it will not get better. It will continue to get worse. I know this. I live in it. I'm immersed in healthcare issues all day long, every day. I work full-time as a clinical physician. And I can assure you, we have gone down the path of atheistic Darwinism, which defines humans as simply talking monkeys and says they have nothing intrinsically special about them. And therefore, we're stuck with this so-called scientism, which basically does tons of bad things to patients, tons of them. Like I said, these psychiatrists becoming, rich and famous by poisoning children with psychiatric drugs that don't work for attention deficit and other childhood so-called psychiatric disorders. Okay, Thomas Szasz continues. Those who suffer from and complain of their own behavior are usually classified as neurotic, whereas those whose behavior makes others suffer and about whom others complain are usually classified as psychotic. Okay, Thomas Szasz. In the past, men created witches. Now they create mental patients. Psychiatry belongs in the same category as astrology, as pseudoscience. Saying a patient has a mental illness is similar to saying that they are possessed by the devil. Okay, Thomas Szasz again. Giving children medications for psychiatric conditions is not treatment. It is poisoning. Yeah, they should be doing a lot of things for these kids, like first of all, making sure they're not exposed to toxins in their food, like MSG in the processed food, like HG in the high fructose corn syrup, like F- in their water, like AL and anything from a can. I mean, kids are exposed to tons of toxins, and their pregnant mothers are exposed to tons of toxins. I'm amazed that people do as well as they do despite all the awful things they're exposed to unnecessarily. Okay, Thomas Szasz continues. As the base rhetorician uses language to increase his own power, to produce converts to his own cause, and to create loyal followers of his own person, so the noble rhetorician uses language to wean men away from their inclination to depend on authority, to encourage them to think and to speak clearly, and to teach them how to be their own masters. Yes, that's how it is. So the base rhetorician is somebody who's lying to you to sell omega-3s or soy or caffeine or whatever the latest BS is, compared to the noble rhetorician who tries to tell you how to take care of yourself. But guess what? The base rhetorician makes a lot of money and fame, and the noble rhetorician gets nothing except he feels good that he did the good deed, which is a valuable thing. Okay, Thomas Szasz continues. Self-respect is to the soul as oxygen is to the body. Deprive a person of oxygen and you kill his body. Deprive him of self-respect and you kill his spirit. As the internal combustion engine runs on gasoline, so the person runs on self-esteem. If he is full of it, he is good for the long run. If he is partly filled, he will soon need to be refueled. And if he is empty, he will come to a stop. And like I said, I think it's good to be stuck up. I've known, great athletes and a few great scholars, and man, they're really stuck up in egomaniacs. But I think that's a good thing, okay? And I'll just give myself an example. I think I'm the best doctor in the world for most things overall. Like McDougall and me, I got advantages on McDougall. He's got other advantages on me. Of all the YouTube doctors. So there's other great doctors doing brave things on other channels that are doing great things. Okay, but you have to go to other places to see them. But on the internet, man, I was amazed when I started going through all the nutrition experts and doctors on the internet, and I'm like, holy crap, almost all of these guys are ignoramuses or liars just trying to sell stuff. Don't get me wrong, there are some great ones. Of course, there's Esselstyn is great, and T. Colin Campbell, and there's other really great ones. And there were some many great ones, Burke, Kempner, etc., etc. But a lot of times they're one-trick ponies, or no, they're gone, or whatever. But anyways, we won't get into that any further. But what I'm trying to say is, having this attitude of yourself, on a mission from God to do good things, and that you are doing good, and that is valuable, that empowers you. And again, that's one of the great things about Christianity. It basically says there's a cosmic struggle between good and evil, and the Christians are on the side of trying to do good things, and that their life is meaningful. And that increases the likelihood a person is going to do something good and beautiful. And that's also why Christians create the best art, the best literature, the best architecture, the best science, you name it. And that's one of the reasons why I became a Christian, because I'm like, holy crap, most of the great achievements from the history of mankind, they come from Christianity. And you can go ahead and compare. Compare the art from other cultures to Christianity. They're a joke, okay? Compare the music to Christianity. The Christianity music. They're a joke, okay? All right, let's continue with Thomas Szasz. Traditionally, men have used power to gain sex, and women have used sex to gain power. Okay, now a lot of jokes can be made about that, but I'll resist the temptation. All right, Thomas Szasz continues. People often say that this or that person has not yet found himself, but a self is not something one finds. It is something one creates. Clear thinking requires courage rather than intelligence. Jung and Adler were an improvement on Freud, but they don't go far enough. The key is meaning. Meaning is what sets people free. And I think there's a lot of truth in that. You want to feel that your life is meaningful, that you're doing something useful, and that can empower you. And then we get into all the stuff about Dostoevsky, Viktor Frankl, Schopenhauer, and others. Basically Schopenhauer had said, it's impossible for a man to try to live a happy life. His best chances to have a good life is to try to live a heroic life. And I think that's an awesome quote. Okay, let's continue. All right, this is the last slide here from quotes by Thomas Szasz. Do unto others as they want you to do unto them. Yeah, and that's pretty well known. So basically, the old version of the Ten Commandment or the Golden Rule was treat others as you would like to be treated. But that's wrong, because when that is the case, people will just define what they want, and they'll say this person doesn't follow what I want, therefore they deserve a punishment. So you got to say treat them as they would like to be treated. Okay, Szasz continues. Every act of conscious learning requires the willingness to suffer injury to one's self-esteem. And that is why young children, before they are aware of their own self-importance, learn so easily. And that is why older persons, especially if vain or self-important, cannot learn at all. Yeah, you got to be willing to admit that you're a beginner and take the little bit of embarrassment or humiliation that often goes with that. If you don't get past that beginner humiliation phase, you'll never progress. And like my experience, a typical person, you try to teach them about nutrition. Number one, they don't want to change their diet. Number two, they don't want to admit they were wrong about anything. But unless they do, they're screwed. Okay, Thomas Szasz continues. This is when he was writing at a blackboard. There's a lecture. I think you can see this one on YouTube somewhere if you look up Thomas Szasz lectures. He gets up to the blackboard and he writes the words depression. Okay, and he says, has this lady patient got an illness called depression, or is she simply a woman who has got a lot of problems and troubles which are making her unhappy? On the blackboard, he writes in big letters, depression, and underneath that he writes, an unhappy human being. Dr. Szasz then turns to face the class and he says, does a psychiatric term say more than the descriptive phrase? Does it do anything other than turn that person with problems into a patient with sickness? Seemingly technical terms used to identify psych illnesses and treatments are simply dysphemisms. Dysphemisms, an unnecessarily negative term, unlike euphemisms, overly positive words. Yeah, he basically says you label people as mental patients and then you can sell them drugs or force them to take drugs. And then he also says the crucial issue is whether the psychiatrist is to be considered the agent of the patient or someone else. Is the doctor a warden, like of a involuntary hospital place or a prison, or is he someone who serves the patient? You know, the patients can't leave these involuntary psychiatric hospitals at will. And he calls this institutionalized scientism. Sometimes atheistic Darwinism is also called scientism, and man is an evil. Once you say a human is not a human, they're just a talking ape. You can do anything you want to them. Anything wrong, abusive, dishonest. They have zero rights. They have zero value. And that's how the United States university system has defined human life. And people who think, oh, atheism is scientist, they don't understand. What they've basically done is create a justification for slavery and cruelty. So anyways, I hope this was interesting. Thomas Szasz, his book is quite entertaining, any of his books. And once again, we're making the point here. Be careful about psychiatry. It's mostly a dishonest joke of a field, and it does more harm to patients than good. You know, don't get me wrong. There are some patients with an acute, psychotic episode where they're endangering themselves or others, and there's other times where patients are really refractory and debilitated, and a temporary use of medications might be of some benefit. I can see there's times when that is true, but the general day-to-day practice of it is awful disgrace that causes brain damage on a widespread scale and contributes to dementia.